So there have been so many advancements in gastroenterology, and I guess as an advanced endoscopist, I would focus mostly on those that pertain to the things that I spend most of my time doing, and so not pay attention to the other great medication and pharmacologic treatment advances that we've had in gastroenterology in general. But in the endoscopic field, we've had tremendous advances in our ability to perform complex procedures and intervene on abnormalities. So one example would be for gastrointestinal bleeding. A long time ago, we had just injection of adrenaline or epinephrine and cautery devices to burn blood vessels that might be bleeding within an ulcer. But over the last few decades, we've had improvements in clipping devices and closure devices. So we have metallic clips that are similar to those used by surgeons in the operating room. Some of them clip and close just surface abnormalities. Some of them can close full thickness openings or defects in the gastrointestinal wall. So these have been tremendous advances. One of the other things has been with regard to endoscopic ultrasound and our ability to image and access areas that are outside of the gastrointestinal tract. So if you went back 40 years ago, one of the greatest fears of a gastroenterologist was to wind up outside of the gastrointestinal tract because it would mean that we had a complication. But now, in fact, our technology allows us to intentionally go to those areas in order to obtain tissue diagnoses and deliver treatments. And then finally, we have access devices that have improved tremendously. So one of those has been something called a lumen-opposing metal stent. This is a device that can create a bridge similar to a surgical connection between one part of the gastrointestinal tract and another. So now we can, for example, drain a gallbladder in a patient who has a sick gallbladder and may not be a good candidate to have that gallbladder removed. We can drain that gallbladder into the gastrointestinal tract all through the mouth by utilizing one of these bridge stent devices. We also can create surgical type communications between one part of the gastrointestinal tract and another in order to circumvent areas of blockage that might be related to cancer. We can use these similar surgical type bridges to do that as well. So some of these technological advances in advanced endoscopy have really improved the services we can provide to patients.